So what would I say to someone who just found out they have kidney disease? I think the message is don't panic, because there are certainly ways that you can control it, and I was quite frightened when I got the news, but it became apparent over a couple of days that this is something that we can handle. You know, it's not it doesn't need to be a life or death situation.
If you're watching this video, it's because you or someone you know may have been diagnosed with end-stage renal disease or chronic kidney disease. The purpose of this video is to let people know there's multiple options out there so that dialysis doesn't have to be in charge of your life. It can just be a small portion of it.
Premier Home Dialysis was created to help educate people about peritoneal dialysis, its ease of use, the way it can empower you, and how it can leave you in control of this disease. 80% of healthcare providers said they would choose peritoneal dialysis as the first choice for themselves, but 93% of patients are started on hemodialysis instead. We are hoping to change that mindset and have more patients start with PD. Premier Dialysis is the first true home program. We come to your home to train you every day. We draw your blood at your home, and sometimes our physician, social worker, and dietitian will come to your home as well. This takes the travel out of your medical treatment. So let's talk about how PD works. We all have a naturally occurring peritoneal membrane in our abdomen. PD uses a catheter which is placed by a surgeon into that membrane in your abdomen. This catheter will then be used to pump a solution into your body. That solution, in conjunction with your natural occurring membrane, will remove any excess fluids and toxins from your system, effectively doing the job of your kidneys. This solution dwells for a number of hours before it is then drained, leaving you feeling balanced. For most people, this procedure will happen at night while they are asleep in bed. Now, some of the benefits to PD include that first and foremost, it is easier on your heart. Secondly, it requires a less restrictive diet. Because you are doing dialysis 7 days a week instead of 3, you are able to eat and drink more of the things you love, within moderation, of course. With PD treatment, you are actually able to maintain more of your residual kidney function, meaning the treatment utilizes any kidney function that you have left and it supplements it with dialysis. It essentially keeps your kidneys functioning longer. Some of the misconceptions you may have read about peritoneal dialysis could include infection. If you follow your training, close doors, keep out animals, wash your hands, and wear your mask, there is a very low risk of infection, and your nurse will be available 24/7. Animals. We believe that you can have animals and be on PD. We will work with you on a setup and design to make sure your animals don't interfere with your treatments. Hernia. If you have a hernia, in most cases, your surgeon should be able to repair that at the time your catheter is placed. Another option we must discuss is hemodialysis. Hemodialysis is always available, regardless of your circumstances. Before hemodialysis begins, your surgeon will place an access, fistula, or graft into your blood vessels. This is an outpatient surgery, much like the placement of the PD catheter. However, it may take 6 to 12 weeks to heal. Once your access is healed, your nurse or technician will place 2 needles into that access at the beginning of each treatment. The bottom needle will pull the blood out and push it through the dialyzer to be cleaned and returned back to you through the top needle. This treatment typically takes 3 to 5 hours, 3 days a week, based on your size and the amount of dialysis recommended by your doctor. You will typically be given an appointment time at an outpatient facility where you will be responsible for driving yourself or finding a ride. Because of the time in between treatments, patients are typically given a 1 to 2 liter fluid restriction to help prevent fluid overload or fluid on the lungs. Some of the side effects of hemodialysis may include blood loss or a drop in blood pressure. Home hemodialysis is also available 5 days a week. It involves daily needles and the same potential side effects. Now, please hear from our patients who have successfully completed the home training program.
So why did I choose peritoneal over hemodialysis? For me, needing to continue working, it seemed that scheduling the hemo was one of the biggest hurdles. Having to sit somewhere for 4 hours, and especially with the history that I'd had, that I didn't handle it well. In fact, one of those episodes, at least one, I felt so bad that I couldn't actually leave. I had to get somebody come get me. And I couldn't imagine trying to continue working on a day that I had to do that to myself. And if I had to do that 3 times a week, I don't think that I could work. I had my training spread out over a month. My nurse, Josh, was great. He helped go through chapter by chapter, and when I came in once a week to have my PD done on site, he would be checking my labs, and then we'd go through the book and actually practice some things. But, PD was really great, and there's no doubt that I did better on PD than I did on hemo, and I'm sure that would be true for everybody, even if hemo is not as big a problem as it was for me. But there are still some things that are difficult with PD, and one of those is travel. So with my work, I in the past had been on planes 3 times a month and flying all over the place, and that's just impossible. You can't carry the cycler through a plane, so unless you've got cyclers waiting for you at the other end, and materials as well, because you can't take boxes and boxes of bags of material. That would take some careful planning. But if it's not going to be forever, and if you're just doing it until you get a transplant, which was my goal, then it's not so bad.
I chose peritoneal dialysis because I'm an owner of a baseball academy, Vega Baseball, and I'm also a baseball coach for ESP, Elite Sports Performance. I had to find some way of doing dialysis without interfering with my life, and peritoneal dialysis was the solution. When I first found out that I had to go on dialysis, the team that was in place to support me really made me feel comfortable with the process and with the results. So I went on peritoneal, and it doesn't interfere with my life. Josh was an excellent trainer. Although the training was 10 days, I felt pretty comfortable with the whole process after 3.
The experience with the overnight exchange and the once a day has just been really great. It's given him a lot of freedom to do whatever he wants during the day, really. He just gets up and we go get our coffee, goes to his job. And one of the best things too is that the amount of supplies is pretty small and limited, so it doesn't take up a lot of space in our home.
With all of these options, it is important that you are placed on the transplant list. We will always help to achieve this, since the main goal is getting you off of dialysis. Now that we have discussed the different types of dialysis, we want to encourage you to talk to your doctor. And if you feel like you have more questions, don't hesitate to call and ask us. At Premier Dialysis, we are available 24/7. We are always here to empower you. Dialysis should give you the greatest results while being the least restrictive on your everyday life. Dialysis shouldn't take over your life, and together, we can get through it.